Good evening, everybody, and thank you for joining the My Pizza Party podcast. My name is Chris, and I'm always joined by
Misty.
and we want to thank you for joining us. And on tonight's topic, we are going to discuss healthcare worker violence. And healthcare worker violence comes in many forms: verbal, physical. It can come from patients, families, your colleagues, other healthcare worker teammates. It can even come from providers. This is going to be an ongoing series as long as we do the podcast because it's such a epidemic across the United States and more than likely across the world. But of course, we're just going to focus on things here domestically. Let's start it off. Misty, you're familiar with healthcare worker violence. Have you ever experienced it in your career?
Yeah, most of the experience I've had has come from more verbal abuse. I've seen it amongst my peer to peer. I've seen it where the patient has been verbally abusive and even the families.
Anything with any colleagues or any providers or any support staff?
So there was a situation in a unit that I worked in where a couple nurses didn't get along, and that never mixes well. And something was said. They were across the unit from each other, screaming profanities and just a cat fight, basically. Nothing got physical, but it was very, very verbal.
How was it handled? Did anybody stop it?
Well, Charge and I kind of separated and took one off. One took one way and I took the other way, and we just kind of tried to calm them down before coming back out. I guess we were obviously leaving for the shift, but they kind of stayed away from each other. But it did get reported to upper management, and I don't really know exactly what happened with that, but it never happened again.
Anything with providers, PAs, MPs, docs?
I've seen them disagree, but I've never seen anything physical. No, I've heard some pretty heated conversations between doctors over, a lot of it was patient care, just ego, stay in your lane type situation, but nothing physical.
No, I know one of the providers that were in your area would be cardiology and nephrology.
Oh, yes. You do not touch cardiology patients, and you do not touch nephrology. And that was actually the case where I seen a lot of disagreements.
Yeah, there's a couple YouTubers and TikTok docs that make fun of that. I don't remember the names, but you can find them. But they make fun of, one of them shows Renal carrying a Morton salt container around, and the other one comes in as cardiology, and they go back and forth with each other, and that is absolutely a true life.
It is 100%
situation.
correct.
Yep. So no physical violence. Any of your colleagues that you ever worked with have any kind of violence, whether it was verbal or physical?
Yeah, I had one nurse, actually, she was a seasoned nurse, 30 plus years. She told me that she was telling some stories that she had, and one of them, she's always kind of worked in the ICUs across them, and a patient got very physical with her and punched her and kind of threw her into the wall. I don't know that whole situation. It had been years ago, but she experienced that. I know nurses, especially in the emergency room, they deal with a lot of battery from patients when they first come in until they can get them restrained.
Battery and assault. Yeah,
Yeah.
absolutely. Did anything come out of that situation with your colleague?
I really don't know because it was years ago and she was still there, so I'm assuming nothing major. I know she didn't press charges or sue or anything like that.
One thing, when I worked, I was physically assaulted all the time. I'm a pretty big guy. I would get called on all the time on our units, whatever unit I worked on, especially for disruptive behavior, sometimes family disruptive behavior. I've been kicked, scratched, bitten. I have been pushed, you name it, I've had it happen to me. And that's just the physical. The verbal abuse, I've been called a racist. I've been put down. I've been called gay slurs because, again, in healthcare, especially in a nursing role, you get grouped into orientation because of that. You name it, it's been presented to me, and from multiple different groups. It doesn't matter. So, and I know a lot of nurse colleagues in the emergency department are 100% exposed to violence in the emergency department. One thing that I always found interesting at the hospital was that during the daytime, everybody was screened and or had their personal effects gone through to get in the emergency department. But then you walk right down maybe 50 feet away to the general entrance to the hospital, and you could walk right in.
Yeah, it was really ass backwards, basically.
What's to stop somebody from just walking down the hall, especially if the case is serious enough? They're not going to get discharged. They're going to be admitted. So the units are, in a lot of these hospitals, the units are right off or right near the emergency department. And so a lot of these hospitals, if you go in during general business hours, operational hours, you can walk right in. There's no security to get into the general hospital.
The ICUs and everything were locked down, but they would get gunshot victims or crashes, car accidents where one individual driving killed another person, and they would end up at the same hospital, and then you would have families all around, and it could become very intense if they figured out who was who and where everybody was located. So just being able to walk in and not be stopped or searched or anything, it was a lot of comments about it.
What did they call people that ended up when you would swipe into your unit? Was it like shadow entry, or what they had a specific name for it? Do you remember what it was called? Where patients, family members, or visiting guests would just wait for the door to open after you badge in?
No, I don't remember the term that you're referring to, but it happened a lot. But when the units, we were really good about stopping people because you just didn't know what was coming in, and we were restricted to certain age limits and how many family members were allowed to be present in a unit. So we always stopped. And when you went into my unit, you were also going in across the hall to our sister unit. So we looked out for each other a lot. And there was a buzzer. They were supposed to push the button, and we could communicate that outside the doors. And I know in the MICU, SICU, they kind of had the same thing where they could see who was out in the actual area trying to get in, the access doors that you could communicate with. But there, you always got that person trying to sneak through.
Yeah, I know it happened quite a bit. Especially, in the busier times, especially during COVID, when people would just, towards the end, when they actually started allowing family members and guests to come in, visitors to come in, it was hard to kind of keep track of. Sometimes the doors were kept open down on your units because I would just usually walk right in, and got kind of a little bit lax, and then it tightened back up. But all it takes is just one time to have somebody come in and everybody's in trouble. The reason why we bring this up is that healthcare worker violence in any capacity is an underreported situation, an underreported statistic.
Well, I think when we talk about healthcare violence, assault, battery, all that, we think of the physical and the verbal part. But along with that physical part, when you're trying to restrain somebody who's violent, you don't even have to be trying to restrain them, because I learned as a seasoned nurse, you don't stand in somebody's way if they're really, really upset. You're just asking to get hurt. So, but one thing that we don't think about is needle sticks, blood. A lot of times this, whatever is going on can lead to blood and body fluids getting loose. And if it gets in your face, your eyes, as a nurse, you have a huge protocol you have to follow with that. So I don't think that's always remembered when we talk about violence.
No, I've almost had a needle stick from a patient grabbing my arm and attempting to jab me with the needle that I just withdrew from their body. Another one is saliva and spit. Been spit on a lot.
We've had to put masks on people, and I know they do that in the emergency rooms when they come in.
Yep. And I will say, at least where we worked, it was a culture thing too. There was a certain there was a certain culture where that's what they did, and when they would get pissed off with what you were doing, they would spit at you. It's the lowest form of insult in their culture. It was a very disrespectful act, especially when you're trying to help these people.
And one thing you have to remember, and this is for a lot of you newer nurses, because you're getting used to being in your skin and your shoes as a nurse. You gotta know how to set your boundaries. When you're new, you want to please everybody. You want to do everything by the book. You want to do it right. You're fresh. You're like, I can't. You don't know what you can and can't do within within reason, but setting boundaries with your patients is very important because it can really determine how your shift is going to go. And as I got older and more seasoned in my career, I kind of knew the second I walked into a room who I was setting boundaries with right off the bat. You get a feel for it.
Yeah. And every once in a while, it's a little bit of a surprise, but most of the time your instinct is pretty right on. And I'll echo that. Setting boundaries early, figuring out how to set boundaries early in your career will really benefit most new grad nurses. It takes about 2 years of functionally working before you kind of are able to tease out what patients are going to be a problem and which ones are not. The ones that are blatant, you will figure that out immediately. But it's the subtle hints on the ones that you'll kind of navigate your way through, and you'll be very surprised at how long that nuance takes to actually develop for the ones that can actually escalate to that point, not the ones that are already coming into that.
Yeah, I don't know how many times when I was first new again, I was the same new nurse trying to please everybody. But towards the end of my inpatient career, I was just kind of like, you know what? You walk into a room, you're meeting this patient for the first time. They're yelling already, demanding things. I just turned around and walked out. It's like, I'm not doing this.
Yeah.
No, we're not doing this.
Nope. And the other thing is, you really want to have compassion and empathy. Early in your career, you want to break through to that person, break down that barrier, and get into their mind and say, look, and get into their soul and be like, I'm trying to help you. Just listen to what I'm telling you, because we're here to help. And then towards maybe 2 to 3 years into it, you're just like, you're not worth the time. I'll advocate you if you're a willing individual. I'll advocate for you if you're one that can't speak for yourself. But if you're alert and oriented and you fully understand your disease process and what's going on with you, and you got to the point where I would know which ones were going to be a problem, especially if I worked back to back or if I worked 3 days in a row, and I would go up and tell the unit secretaries which ones I needed to have the AMA forms already pre-printed on, because we had AMA templates that would print the patient's MAR number, their medical record number, and their name and their date of birth. So that way when they would sign, it would automatically be scanned and uploaded to their chart. But I already had the unit secretaries print out the ones that I thought, and 9 times out of 10, I was correct.
And it's kind of funny because you brought up, telling your patient that, hey, we're here to help you. That almost seemed to make the patient even more mad, because they didn't want to hear that. When they get into these emotions of theirs, they don't want to hear that you're there to help them. They want to hear that you're going to do what they want you to do.
Yeah.
And that's not always the safest thing for the patient, but trying to rationalize with some of them is just about impossible.
It's like a 5-year-old having something taken away or not getting something that they want.
And I get it. I get that you're in the hospital. You do not get rest when you're in the hospital, especially depending on the certain unit you're in. If you're in the ICUs, we're constantly in our rooms. There's a reason why sometimes patients want to come back to the ICUs.
Yeah.
But we're there. We are really there to help you, but we are also not a 5-star resort.
We were treated like servants a lot of the time.
Mm-hmm.
One thing that most people don't realize is that a lot of these bigger health systems have their own internal police department, and what these larger health systems will say, it's for patient safety. We have our own internal police department, police officers, off-duty police officers that come in, They'll have police officers that are trying to get their badge time in to maintain their certifications, and they'll work on like a contract basis. But the other thing is that if you have your own police department, you have your own internal reporting system, and you don't have to have those records become public. You can create your own like little fiefdom. Now, they would not detain patients and put them into a cell, but they would transfer. They would transfer out to whatever municipality that the hospital was located in. But again, some of the internal situations that we dealt with were kept internal. So that,
well, a lot of times you didn't even know they were happening until you heard it through the chain of communication.
right, and that's why at some of these hospital locations, you'll have staff members that'll be sexually assaulted or assaulted in the parking lots on the facility or on the healthcare system property, and that's the end of it. You don't hear it. It's not really investigated unless it's turned over to the local municipality where detectives and or other people can investigate it. You would have carjackings, all sorts of crimes that would happen. And again, unless it is turned over to the local municipality, that would be the end of it. And I could go into stories about where we worked at and the amount of issues that we had in the parking garages or in the parking lots, but you never heard about it in the news. And that's another thing. So a lot of this stuff is, or another one was family members waiting in the parking lot.
Oh yeah.
I mean, there are nurses, there are aides, there are doctors, there are techs that are approached by pissed off family members that will watch. They may indirectly see a doctor or a nurse come in that's taking care of their loved one, and they will wait there. They will stalk you in the garage. They'll be down in the waiting area at the front of these hospitals where the general personnel and hospital staff walked by to get to the parking garages, and they'll wait there because they know when the end of shifts are.
Well, in some cases, you were walking even not into your garage. You were walking a good distance away from the hospital to get to your car.
Yeah.
And at night, in the dark, you try to leave in groups after your shifts, but it doesn't always work out that way, depending on the type of shift you had. You may be one of the last out. I know there were times I was walking out at 9:30 by myself, and after a really rough day, you're kind of on guard because you're like, oh man, it was rough. That family was not happy.
No.
It was scary.
Yeah, and that brings us up to some of the most recent events that has happened. Like locally where we live in Columbus, there was a nurse on a postpartum floor. She was assisting a mom in a newborn, and ended up having to intervene with a suspect that is now being brought up on charges because something happened. There was a domestic dispute between the mom and dad, and she stepped in between the dad or whatever family member this was. I mean, alleged family member in an alleged situation. And he took her, strangled her, and then drug her out to the hallway by her scrubs, which ended up starting to choke her. And the travesty of that situation, which is a whole nother thing that we'll be talking about, is the lack of follow-up by the hospital staff to see how this individual was doing.
She didn't even get assessed in the emergency room.
No, but I think she may have turned it down. But
I don't know
whether she turned it down or not. Nobody that was there from nursing operations, because every hospital has a nursing operations manager that kind of oversees the facility operations. They have them 24 hours a day, 7 days a week. And nobody from nursing operations checked in on her. Nobody from the individual's unit checked on her. And that's the greatest letdown. And that tells you all you need to know about the way some of these healthcare systems actually operate and treat their healthcare workers.
The union really jumped on that, though.
Yeah, I got a notice that the union's going to be striking on the 2nd or 3rd, and they're throwing it out, and rightfully so, because then there was another incident within that health system. There was one in Pennsylvania with a known patient that had mental health issues, assaulted a nurse, got him down on the ground, got beat him in the head. He had a brain bleed. He had his facial lacerations, just a whole bunch of physical injuries. And who knows, just that one incident, that's going to potentially maybe have long-term consequences for that healthcare worker. There was another one in North Carolina. There were two in, what happened to two in California. That wasn't necessarily violence, but maybe the situations at the hospital led to them doing what they did.
Yeah, there were two of them within a week's time, a week apart of each other, in different areas even, committed suicide. People don't realize the trauma that you come home with and the PTSD that you deal with as a nurse sometimes. And a lot of times our job is very rewarding, but there's a lot of toxicity that happens, and it's very, very taxing on the brain.
Yeah.
And your emotions, and it's really hard to know how to let it go when you leave, especially when you're just beat up one shift after another.
The one thing that we posted a video about the situation in Columbus, and I had an individual comment, well, welcome to customer service. And, that happens all the time. And I'm sorry, there's a difference. I've worked retail. There is a difference between selling products or selling a good and having to take care of a human life. And the stress is not comparable. You can argue that with me all day long until you've worked in the shoes of a healthcare worker in any capacity, whether it's a tech, an aide, a nurse, mid-level provider, tech, does not matter. You have no understanding what it's like to have the life of somebody in your hands, and not just one life. If you work at the hospital, you have a minimum, depending on where you work, intensive care units, maybe up to 3.
Yeah.
Step down units, 5.
4 to 5.
Med surg units, OBS, 7 to 9, maybe even 10 patients.
Yep. I hate to say it because in the ICUs, it's normally 1 to 2 on good days. On bad days, you're getting 1 to 3, and they will even give you 1 to 4 in some situations.
Yeah, and so I'm sorry, you have a life in your hands, and you're dealing with all of this stress, quote unquote, customer service position, unquote. You don't deal with a human life. You're selling products. I'm sorry you didn't get your radiator. I'm sorry you didn't get your bottle of shampoo. I'm sorry your food wasn't prepared. If you get assaulted for that, shame on that individual for assaulting you. But you're dealing with that and trying to make sure that they don't die and that they're getting better under your care. It's a completely different circumstance. And I say that as somebody that has worked retail in multiple retail environments and had to deal with customers in customer service environments and finance and everything else. It is a whole different thing. And I will argue that. And I think my wife would argue that all day long.
Yeah.
So we wanted to, this is going to be kind of a shorter episode, but we're going to be spending a lot of time with this in the future and just keeping people apprised of what's in the news. Misty and I actually developed a organization on Facebook called Caffeinated Army of Nurses. It's kind of fun, but it's also going to be serious. But that can be found on Facebook at Caffeinated Army of Nurses. Both Misty and I want to tell everybody it's Thanksgiving. Enjoy your break if you can. If you're one of those lucky ones that do what we do and you're able to visit and spend time with family, go for it.
Yeah, and I want to say thank you to all of our healthcare workers, no matter what your role is. We appreciate you. We know it's hard being away from family on holidays, but we appreciate everything you are doing. And that goes for our military, our cops, firefighters, EMTs, anybody who's out there working. We appreciate you.
Yep. And our retail friends.
Yeah.
I'm sorry. I don't think Black Friday is the way it used to be. Do you? No. I mean, there's still people lining up, and you don't see the ravenous crowds like you would at Walmart and other places.
Well, everything's so accessible on the internet now.
I remember on Black Friday, people like Best Buy, they would be
now they'd be lining up.
Yeah, it's weird. Like, hey, I'm gonna bring you Thanksgiving dinner so you can camp out at Best Buy. And you'd have the pop-out chairs, and they would be out there with heaters and stuff for 24 to 48 hours before the store opened.
I remember getting up at 5 in the morning to go.
To get 1 or 2 advertised items that weren't even in the store in the first place. They just did it to get you there. But now everything's so accessible on the internet that I just don't think it's as big. I mean, it's still a thing with some stores, but I just don't think it's there. But to our retail friends, anybody in food services, anybody running movie theaters, any other capacity that we don't name, we see you. We empathize and sympathize with what you're going through the next 4 days. And we really truly do appreciate it. Even if you don't get the thank yous, we will thank you. Be safe in your travels. There's a lot of stupid drivers out there. Don't be one of them that we add to that stupid driver list. Like I said, you are more than your positions. You are more than your jobs. Spend time with your family. Spend time working on your mental health. If you haven't spoken to somebody that might be feeling it this time of year because of all the holidays, just reach out, give them a 5-minute phone call. Sometimes that's all it takes. So just enjoy it. And sorry for all you people out there, but OH.
I-O.
That's right. OHIO. OHIO. Sorry. We're Buckeyes fans. We're gonna throw it down. Anyway, we'll see you on the next episode. We haven't really thought about what we're doing just because it's the holiday, but when we figure it out, we'll post it up on TikTok and YouTube. Until then, take care.
Until then.
Healthcare heroes on the grind, underappreciated. Weekend comes, but the pizza's not celebrated. Managers order, they just can't seem to get it right. We gather round, but we're ready for a bite tonight. No toppings, no love, cold slices on our plate. Pizza party, let the podcast begin. Healthcare warriors, let the laughter spin. Through terrible toppings and grease that we dread, we'll keep this conversation alive instead. Chit chat, laughter, it's our weekly unwind. But this cardboard crust feels like a sinister sign. Heartfelt stories wrapped in cheesy regret. As workers unite over this pizza we fret. A slice of happiness, more like a slice of pain. Pizza party, let the podcast begin. Healthcare warriors, let the laughter spin. Through terrible toppings and grease that we dread, we'll keep this conversation alive instead. So here's to the workers, may your pizza improve. Together we'll rise and we'll make our groove.